Today, we're going on a bit of a different journey, a journey into the world of medicine and biology, but even more importantly, a journey centered around awareness and understanding. We're going to be talking about AIDS, a condition that has impacted millions of lives globally. Now you might be thinking, AIDS? That's heavy stuff and you wouldn't be wrong, but it's also incredibly crucial to be informed about. We're going to uncover some mind-blowing facts about AIDS that you probably haven't heard before. We'll delve into its history, the science behind it, and the social impact it has had. By the end of this video, I guarantee you'll walk away with a newfound understanding of this global health issue. So buckle up, grab your thinking caps, and let's get right into it. Before we get into the nitty-gritty, let's start with the basics. AIDS, as you may or may not know, is actually an acronym. It stands for Acquired Immunodeficiency Syndrome. Now let's break that down a little. Acquired means you're not born with it. You get it during your lifetime. Immunodeficiency refers to the weakening of the immune system, your body's defense mechanism against diseases. And syndrome signifies a collection of symptoms and illnesses that occur together as a result of the immune deficiency. Essentially, AIDS is a condition where your body's defense system is so compromised that it struggles to fight off even the simplest of infections. So, what causes this severe immunodeficiency that characterizes AIDS? The answer lies in a tiny but mighty foe, HIV, the human immunodeficiency virus. This virus is the culprit behind AIDS. Think of HIV like a master saboteur infiltrating your body's defense headquarters. It specifically targets and attacks a type of white blood cell called CD4 cells, which are key players in the immune response. As HIV multiplies, it gradually destroys these CD4 cells, weakening the immune system's ability to fight off infections. This leaves the body vulnerable to a wide range of opportunistic infections that a healthy immune system would normally handle with ease. Now let's zoom in on the cellular battlefield where HIV wreaks havoc. CD4 cells, the prime targets of HIV, are like the generals of our immune system, coordinating the body's defenses against infections. They are essential for a healthy immune response. However, HIV is a cunning adversary. It latches onto these CD4 cells, injecting its genetic material and hijacking their machinery to create copies of itself. These viral copies then go on to infect more CD4 cells, leading to a vicious cycle of destruction within the immune system. Now for the big question, is there a cure for AIDS? As of today, the answer is no, there's no magic bullet to completely eliminate HIV from the body. However, that doesn't mean there's no hope. Thanks to incredible advancements in medicine, we've come a long way in managing AIDS. Enter antiretroviral therapy, or RT for short. This life-saving treatment involves a combination of medications that work together to suppress HIV replication in the body. ART doesn't cure HIV, but it significantly slows down its progression, allowing people with HIV to live longer, healthier lives. Understanding how HIV is transmitted is crucial for effective prevention. Contrary to some misconceptions, HIV is not spread through casual contact like hugging, shaking hands, or sharing food. The virus is primarily transmitted through specific bodily fluids: blood, semen, vaginal fluids, and breast milk. These fluids must come into contact with a mucous membrane like those found in the rectum, vagina, penis, or mouth, or directly enter the bloodstream for transmission to occur. It's important to note that HIV cannot survive outside the body for long, so transmission through surfaces is extremely unlikely. The emergence of AIDS in the early 1980s sent shockwaves through the world. It was a new and terrifying disease, initially shrouded in mystery and fear. The first cases were reported in the United States in 1981, primarily among young, previously healthy gay men. This led to misconceptions and stigma surrounding the disease, with many wrongly believing it to be a gay disease. However, we now know that HIV does not discriminate. It can affect anyone, regardless of sexual orientation, gender, race, or ethnicity. One of the most significant breakthroughs in the fight against AIDS has been the development of antiretroviral therapy, or ART. This revolutionary treatment has transformed AIDS from a death sentence into a manageable chronic condition for millions around the world. ART works by interfering with HIV's ability to replicate, preventing the virus from multiplying and damaging the immune system. By taking a combination of HIV medicines daily as prescribed, People with HIV can keep the virus suppressed, protecting their immune systems and drastically reducing the risk of transmitting HIV to others. While ART has been a game-changer for those living with HIV, what about preventing new infections? Enter pre-exposure prophylaxis, or PrEP, another powerful tool in our arsenal against HIV. PrEP is a medication that, when taken as prescribed, can significantly reduce the risk of HIV infection. It works by blocking HIV from establishing itself in the body. Studies have shown that PrEP is highly effective for preventing HIV transmission, especially among individuals at higher risk of exposure. PrEP, along with other prevention methods like condom use, regular testing, and harm reduction strategies, is crucial for ending the HIV epidemic. Living with HIV/AIDS goes beyond the physical challenges. It also involves navigating a complex landscape of stigma and discrimination. Despite scientific advancements and increased awareness, people living with HIV/AIDS continue to face prejudice, fear, and social isolation. This stigma can prevent individuals from seeking testing, disclosing their status, and accessing the care and support they need. It's crucial to remember that HIV is a medical condition, not a moral failing. Breaking down stigma requires empathy, education, and open conversations to foster understanding and acceptance. The fight against AIDS is a global one, requiring collaborative efforts from governments, organizations, communities, and individuals worldwide. The good news is that significant progress has been made in reducing new HIV infections and AIDS-related deaths. Organizations like UNAIDS and the Global Fund are working tirelessly to provide access to HIV prevention, testing, treatment, and care services. The goal is ambitious but achievable: to end AIDS as a public health threat by 2030. By working together, supporting research, and advocating for equitable access to healthcare, we can make this vision a reality. That's a wrap on our deep dive into AIDS. We've covered a lot of ground, from understanding what AIDS is and how HIV attacks the immune system to exploring the marvels of ART and PrEP, and acknowledging the persistent challenges of stigma. I hope this video has armed you with knowledge, sparked your curiosity, and inspired you to join the movement to end AIDS. Remember, knowledge is power, and by sharing accurate information, challenging misconceptions, and promoting understanding, we can create a more informed and compassionate world for everyone. What did you find most surprising about AIDS? Let me know in the comments below, and let's keep the conversation going. Thanks for watching.